Hello, I'm Jacqueline Joss. I've been the program director since the residency started in 2003. The purpose of our program is to build upon your doctor of pharmacy education and to enhance your clinical skills in providing evidence-based and patient-centered medication therapy management, and doing this within an interdisciplinary team. Our goal is to prepare the resident for eligibility for board certification and/or PGY2 residency training, if that's the planned path. By being a small program, we've been able to maintain flexibility and individualization for each resident. We do have the traditional block rotations, but we also have longitudinal rotations in patient care by staffing in acute care and in the ambulatory clinics. Residents also provide diabetes education in the free medical clinic in downtown Corvallis, and this allows the resident to experience the efforts by Samaritan to improve access to care for an at-risk population. This, of course, speaks directly to our mission of building healthier communities together. We do have a required management rotation. This will teach leadership skills that are important in any practice setting. An important emphasis of our program is to develop expertise in quality assessment and quality improvement. The required longitudinal project sometimes is publishable research, but can also be the assessment or improvement of an existing or current service at Samaritan. Last but not least, the resident will also gain experience in education of patients and healthcare providers in our system, and we do offer an elective teaching certificate through OSU and Pacific University.
I was attracted to the Willamette Valley in that it was a more rural setting than a large metropolitan area. I like the idea of having local sports and activities, and honestly, I like that it's the home of the Oregon State Beavers. Fun fact, our pharmacy program was started before our medical residency program. Since we have both pharmacy and medical residency programs, we have an environment that fosters learning and working with other developing medical professionals. Pharmacy preceptors only have one pharmacy resident on rotation at a time. Therefore, you will work very closely with your preceptor. Early in each rotation, the preceptor will model our role within the healthcare team. We gradually add responsibilities for the pharmacy resident. The goal by the end of each rotation is for the pharmacy resident to be able to independently operate within the healthcare team in the role of the specialized clinical pharmacist. On rotation, you will work with multidisciplinary teams in participating in rounding and making clinical decisions based on evidence-based medicine.
Here at Samaritan, our ambulatory care pharmacists are embedded in the primary care clinics and are a trusted and knowledgeable part of the patient care team. We provide consultations and work alongside the physicians and other advanced healthcare providers within the office under collaborative drug therapy management protocols. We have independent pharmacist appointments where we provide disease state and medication education to patients, as well as start, stop, and change medications for disease states like hypertension, diabetes, heart failure, COPD, and asthma. Almost every new service we have started in our ambulatory care clinic has started as a resident project, and it's amazing to see the hard work residents do during their one-year training experiences turn into incredible service that both advances pharmacy practice at the site and improves patient care. After training at Samaritan and playing huge roles in changing processes and practice, many former residents choose to take post-training positions as staff at Samaritan. We love it so much when our former residents stay as part of our Samaritan team, and they can see the impact of their project beyond their year.
After I graduated, I did my residency here at Samaritan. I precept a required rotation, which is the acute care rural rotation at our 25-bed critical access hospital in Lebanon. This is different from the acute care rotation at the Good Samaritan Regional Medical Center because we are a much smaller site. Although we are small, we have a variety of specialties, including an acute care med-surg unit, a critical care unit, an ambulatory infusion center, emergency department, family birth center, and much more. Residents on rotation with us will get a well-rounded experience that really prepares them to be a clinical staff pharmacist, while also considering individual patient needs throughout the continuum of care and working collaboratively in a tight-knit multidisciplinary team.
Hi, I'm Olivia Pipitone. I'm a biostatistician at Samaritan, and I work in what we call the Research Development Office. We help with study design, data collection, data analysis, and we help trainees create final products from their work, like posters to present at conferences. Our office is just one part of a larger department of Samaritan called SHORE, which stands for Samaritan Health Outcomes Research and Evaluation. And it includes Samaritan's clinical research team, a medical librarian, and Samaritan's IRB. The SHORE department works together to help Samaritan conduct impactful and high-quality research. For example, we recently finished a very successful project through a collaboration between our pharmacy team, including a pharmacy resident, and our cardiology team.
My name is Dan Rackham, Chief Pharmacy Officer for Samaritan Health Services, a 5-hospital regional healthcare system in Western Oregon. We host the Pharmacy Residency program at Good Samaritan Regional Medical Center and also have hospital pharmacies in Albany, Lebanon, Newport, and Lincoln City. Our pharmacy enterprise includes hospital, retail, specialty, infusion, and ambulatory pharmacy services, with 20 departments and over 200 employees. I focus on providing the residents' perspective and tools on stewardship of the pharmacy enterprise and the roles and responsibilities of the pharmacy executive. Getting management rotation experience as a resident has great value, whether you plan to become a manager or not in your career. The leadership, quality, financial management, and time management principles incorporated into the rotation benefit our residency graduates no matter where they end up practicing pharmacy. I look forward to talking to you more about our pharmacy residency program and hope you will join us in our mission to build healthier communities together.